You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you for joining me on this week's episode of Simple Health Radio. I'm your host, Dr. Emron. Today we will be discussing the case of a young man who I saw recently with a very particular rash. We'll call him Jaquan. Jaquan was 15 years old. He was African American and a healthy basketball player. He was brought in by his mother due to a rash that she had noticed on his back. She had actually noticed the rash in June, and she thought the rash would disappear on its own. She never really took him to the doctor at that point since he had no other symptoms. He actually had no itching, pain, or drainage. He went away to basketball camp and came back about a month later, and the rash had increased in size. She then used some over-the-counter medications like topical ointments and cortisone, but the rash continued to worsen. When he started school at the end of August, the rash was covering his chest and his back. He still had no symptoms, but the rash was causing a change in the skin color, and that's when she brought him in to see me. When I examined him, he actually had no other abnormalities except for this circular area with multiple patches of different sizes that were covering the middle of his chest and the middle of his back. He had no lesions, he had no rash on his arms or legs, and he had no other findings that would be concerning. For example, he did not have acne. He had no signs of any other infections, injuries, or scars. When I examined him, I was struck by the fact that the rashes were asymmetrical, meaning they were slightly more to one side. They were not in a butterfly distribution, meaning they were not equally present on the left or the right. And at that point, I knew what the diagnosis was. This young man had Tinea Versicolor, and that's what we're going to talk about today. Tinea Versicolor is actually a very common rash. It's caused by a fungus or a yeast. The old name for this was Malassezia fervor. There's a new name called Pityrosporum. It's basically a slow-growing fungal infection that's actually a normal part of skin for most young teenagers. There are different prevalences worldwide. People who have darker skin are actually more likely to develop it compared to people who are of Caucasian descent. For example, in Scandinavian countries, less than 1% of people have Tinea Versicolor. However, in tropical countries, up to 50% of people may be affected. The peak age is actually in the teenage years, so people who are 15 or 16 years old are much more likely to have it compared to older adults. The Malassezia, or the Pityrosporum, is a slow-growing fungus. What happens is the yeast cells will begin to multiply, especially when they are exposed to hot, humid weather. Also, sweating can cause it to increase, and certain oils that are naturally produced in the skin will enhance their growth. And that's why it's more common in teenagers, because they are more likely to be outdoors and active, more likely to be in sports, more likely to sweat, and more likely to have oil and pores all over their body that would allow this fungus to grow more rapidly. The name versicolor actually identifies the variability in the pigmentation. In this particular case, the yeast actually grows in a special way. It doesn't cause scaling or bumps above the skin. It grows slightly below the layer of the outer skin. This causes hypopigmentation, which means it's lighter than the surrounding area. It can also cause hyperpigmentation, meaning it becomes darker than the surrounding area, or it can cause mild erythema, which means redness. In people who are lighter skinned, hyperpigmentation is actually going to be a light brown color. However, in people who have darker skin, the hypopigmentation makes it much lighter. It almost looks like a very beige or almost white color appearance. The lesion or the rashes themselves are generally going to be circular, and over time they will increase in size and they can spread throughout the body. The most common areas are going to be the chest, the back, arms and legs, but also the neck and the face can be affected. The diagnosis is typically made by clinical presentation, meaning once you look at it, it's fairly clear as to what may be going on. However, a dermatology consult may be beneficial if there's a possibility of some other causes. For example, vitiligo. Vitiligo is an autoimmune disorder. It's not caused by a fungus, but it is something that causes depigmentation and it worsens rapidly over time. So people who have Tinea Versicolor, it's going to be a much smaller, milder infection People with vitiligo can have severe symptoms that can ultimately lead to a form of albinoism. There are other causes, such as pityriasis, syphilis, and many other types of lesions that can cause dermatitis. And that's why, if the initial therapy doesn't work, a consultation with a dermatologist is advisable. Now, as I mentioned earlier, although the fungus is a part of the natural anatomy or the natural microbiome of the body, there are some medications that help to eliminate it. These are typically going to be antifungal medications. Topical therapies include a special shampoo or a cream. Common names include ketoconazole. This has to be used for at least 2 or 3 weeks on a regular basis in order to disrupt the skin surface and allow the healthy skin to grow underneath it. Terbinafine is another form that is available over the counter. Selenium is also a method that has been tried. Although it's not a pure antifungal, it may provide some benefit to certain people. In cases that are resistant, people may end up on oral medication, such as itraconazole or fluconazole. These are prescription-only antifungal pills that are taken for several weeks. This would be a systemic therapy, but there are some side effects, which can include liver dysfunction, and so it's only recommended in cases where the topical forms have failed. Now, as I mentioned earlier, Tinea Versicolor changes in appearance. So when people are sweating or playing football or basketball, the lesions are much more noticeable. They're also worse when people take a shower. So the hot water, when it touches the skin, will make it glow almost like a neon light. And in colder weather, for example, in January and February, the symptoms may actually resolve. It is not technically contagious, meaning it doesn't go from one person to another like other infections might. However, because it's a cosmetic issue, family members, friends, and classmates often become nervous about being associated with that person. So the key is just to recognize that it is Tinea Versicolor. It's a fungal infection. You can try some over-the-counter medications for a period of time. If that's not working, talk to your family doctor or pediatrician. If you're still not seeing improvement, see a dermatologist, and they will offer definitive treatment. Hopefully it resolves after that. Otherwise, they can advise you on what the next steps would be. I do hope that you learned something about Malassezia fervor, along with information about Tinea Versicolor on today's episode. Follow us on Instagram. We have a very active following. Send us photos of your experiences with Tinea Versicolor, or if you or your family member have been treated successfully, we'd like to find out what helped you and what did not. I do look forward to having you all on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&0 Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.